And good morning, and let me extend my sympathy to the sister who told her story. Being a mother and a grandmother, I certainly feel for you. To Vice President Harris, thank you for hosting this critical summit. To Administrator Brooks LaShore for moderating the discussion, I thank you as well. And to my fellow panelists and to the invited guests who are here today to share why we must build back better by addressing maternal health. I'm Congresswoman Alma Adams, and I am so pleased to represent North Carolina's 12th Congressional District, more than 900,000 residents in Charlotte and Mecklenburg County. As co-chair and co-founder of the Black Maternal Health Caucus and co-lead of the Black Maternal Health Momnibus Act, maternal health is extremely important to me and to the sustainability of our nation. About 700 women die each year because of complications in pregnancy and childbirth, and sadly, approximately 60% of these are preventable deaths. Our nation is one of only 13 countries in the world where the rate of maternal mortality is worse than it was 25 years ago. But what's more disturbing is that across the country, Black women, regardless of socioeconomic status, are dying from preventable pregnancy-related complications at 3 to 4 times the rate of non-Hispanic white women. And research also suggests that the cumulative stress of racism and sexism undermines Black women's health, making them more vulnerable to complications that endanger their lives and the lives of their infants. And for me, my work in Black maternal health began when my daughter, a Black mom herself, survived a complicated pregnancy that almost claimed her life after her complaints of pain in her abdomen were overlooked by her physician. And overlooking pain of Black women in healthcare results from implicit bias and racism, and higher amounts of implicit bias result in lower quality of care. These disparities also impact other groups like Hispanic and Asian and Native American birthing people who also experience pregnancy complications at a higher rate than white women. And so to address this issue, the Build Back Better Act includes all eligible provisions of the Momnibus, making historic investments to address social determinants of health and to fund community-based maternal health organizations and support moms with mental health conditions and substance abuse disorders, just to highlight a few. The Build Back Better Act will save lives and help American families avoid the devastating loss of a mother, a sister, a daughter, an aunt, or a friend due to pregnancy-related causes. I'm so pleased now to introduce my guest today, Dr. Ann Newman, a board-certified specialist in psychiatric nursing and a very good friend. Dr. Newman has practiced therapy in the community for over